Vince Gutierrez here, physical therapist out of Joliet. Today I'm going to cover one motion for the cervical spine. I've had a lot of patients ask me for videos on this motion, so it seems appropriate for me to just make a video of this motion and issue it to patients in some form of a link, and so I'll be putting this onto YouTube. In the meantime, while I'm doing this, if you're watching, feel free to ask any questions you would like to ask. First motion I'm going to be doing is cervical retraction. When we give cues for retraction, we want to make sure that the head stays in the same plane. Okay? We're not tipping up into extension, and we're not tipping down into lower cervical flexion. What makes retraction a special movement is that it hits end range flexion of the upper cervical segments, even though it's not at end range of the lower cervical segments. This is an important movement to do for people who have this chronic forward head posture. We see it helps headaches. It can help some symptoms that radiate down into the neck. May not help symptoms that radiate down into the arm, but it can also help establish that baseline posture for you from this forward head position. And this is one of the main reasons why I tend to give this exercise, is for headaches, just returning back to what would be considered a normal posture based off a plumb line, and getting the patient prepared for cervical retraction extension. So exercise number one is retraction, and it's straight back into this position. Hold for 2 seconds and back off. Straight back into this position, hold for 2 seconds and back off. Can you take it from the side? Some patients are going to develop a double chin when they do this. Don't be self-conscious. That's normal. It's expected. And then return. When we look at what's considered this typical plumb line posture, the middle of the earlobe should be sitting over the middle of the shoulder. For full retraction, your goal is to take it back until you feel a strain in the neck, and then you back off. Hold for 2 seconds and back off. In order to elicit tissue remodeling or this stretch tolerance, it typically takes up to 6 weeks. Awesome. Thanks for watching. Cool. Done?